Good afternoon, and thank you for joining us for today's virtual media conference about vaccination requirements in sports and recreation facilities. We're glad to have you along with us. Also happy to be joined this afternoon by the Medical Officer of Health at Huron-Perth Public Health, Dr. Miriam Claussen, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackey, and the Medical Officer of Health at Southwestern Public Health, Dr. Joyce Locke. And a welcome to the media in attendance this afternoon. We do have a lot of you joining us online. We will have an opportunity at the end of today's announcement for media questions. I would ask that you please indicate your name as well as your media outlet and who your question is for. And to do that, all you need to do is click on the question mark inside the text bubble here on Microsoft Teams to submit your question. And again, this is a virtual media conference and questions will be taken from members of the media only. So once again, and we do recognize that we have media joining us from Huron-Perth and also from the Southwestern Public Health region. Please indicate your name as well as your media outlet when you submit your question. We'll begin this afternoon's announcement by turning things over to the Medical Officer of Health from Huron-Perth Public Health, Dr. Miriam Claussen.
Good afternoon. Thanks, Dan, and thank you everybody for joining us. Today, Huron-Perth Public Health, the Middlesex-London Health Unit, and Southwestern Public Health are announcing additional steps for our communities regarding proof of vaccination requirements at recreational facilities used for organized sport. And I see that you've put up the slide, so thank you for that. Proof of vaccination will now be required from anyone 12 and over who participates or is involved in organized sports, including those playing, coaching, officiating, volunteering, or spectating. The requirement will take place on October 31st, 2021, and will apply to the City of London and Middlesex, Elgin, Oxford, Huron, and Perth counties. The three units will issue letters of instruction to the owners and operators of facilities in the communities they serve, where organized sports are played or practiced. The letters of instructions extends the provisions of the province's Reopening Ontario Act, the Regulation 364/20, which currently requires proof of COVID-19 vaccination and identification for all those aged 18 or older who actively participate in organized sports or recreational fitness programs. In addition to players, the provisions of the letters of instruction will also apply to coaches, officials, volunteers, and spectators aged 12 and over. I will now hand this over to Dr. Mackey.
Thanks very much, Dr. Claussen, and it's really a pleasure to be here with my colleagues from Huron-Perth and Southwestern Elgin at Oxford. This is a group of 3 health units and medical officers that have worked together throughout the pandemic, and to be able to bring this announcement together is, I think, a really important milestone. The main rationale here will not be a surprise to anyone. The Middlesex-London Health Unit issued a recommendation to all sports leagues on August 27th that proof of vaccination be required for anyone eligible. And we issued the same recommendation to all employers in the region on September 3rd. Sports activities by their nature create additional opportunities for the COVID virus to spread. That includes the issue around being in close personal contact, which is often required in sports, even non-contact sports. That 2-meter bubble is routinely, not part of the sporting culture or needs of the game. You've got increased respiration and metabolic activity. Both of these mean that the people playing the sports are at increased risk of both inhaling the virus or exhaling and pushing that virus at the people around them. You've got the fact that many sports require people to be unmasked in order to reach their full capacity. And then you've got the prolonged aspect of the contact that's often involved. And in particular, when sports are played indoors, which is what this order really, the letter of instruction really addresses, that indoor aspect adds to the level of risk. And I'm just going to make sure that, so we do have another slide. Lots of questions about why this is happening and why this is happening now. This slide shows the spread of COVID at an outbreak that happened in the Peel region. This slide was produced by Peel Public Health and is shared with their permission here. This was a significant hockey tournament in the Peel region in late August. So at a time when, you know, anyone over age 12 could have had 2 doses of vaccine available to them. And at that time, there were some of the players who were unvaccinated. It looks like 2 players arrived with COVID, and they spread it to at least 8 other players in the tournament who also spread to some secondary household cases. Most of those household contacts were fully vaccinated, which protected them against developing COVID. Unfortunately, there was further spread out of that outbreak from this hockey tournament in Peel, and spread that may well have seeded other outbreaks or spread around that community. This is not the largest example. There are many examples of outbreaks of COVID associated with indoor sports, hockey, soccer, and many others, but it is one that's recent and in the context of the vaccination era. So we felt this particularly relevant to share today. Dan, I'm going to pass to Dr. Joyce Locke, who's the Medical Officer of Health with Southwestern Public Health at this point.
Thank you, Dr. Mackey, and we'll go to the next slide now. It's a pleasure to be with all of you today. And just to reiterate and follow up on Dr. Mackey's message, this letter of instruction is all about preventing further serious transmission and from that serious illness. It's about preventing transmission between players, coaches, and their families. As we saw in that previous slide, it doesn't take much from it to get to the player, to the family, to other circles that we all engage in. So, and we all know that these sports events are family events where siblings go and parents go to watch their children. They're community events where multiple families get together and chat and stand at the sidelines to cheer while the players play. So there is a lot of interaction between individuals. We know that these sports events are very good for our physical health and our emotional health. So we want to make sure that we continue to have these events carry on all winter this winter, but we also want to make sure that they're not the source of spread of COVID through our communities. So that's why we are we're sending out this letter of instruction. We're moving beyond just the players to those on the sidelines who are spectating and coaching, because you often know each other. Parents act as coaches, friends act as coaches. People are in smaller events where they're pretty close to the side of the sports activities, and so it's all one common space where people breathe the same air. So we are also setting the date for the start of this proof of vaccination to October 31. We do realize that people have made their plans for sports activities for themselves and their families this upcoming winter, and that these new changes will impose some changes for some of these families. So we're giving you several weeks of time so in order to be able to get vaccine if you haven't already gotten it, or also to work with your conveners and the facility owners to reconsider your participation if you're not going to get vaccinated. We also want to remind everybody that we've got vaccination clinics in multiple places in all of our health units, where people can make appointments or where people can just walk on in anytime to get their shot. We also would like to encourage everyone to continue to show kindness to one another this winter. This issue about being vaccinated or not vaccinated is divisive, but remember, we all try to make the best decision for ourselves and our family. I'm going to hand it back to Dan now.
Thank you very much, Dr. Locke. Thank you, Dr. Mackey and Dr. Claussen. All right, this is where we will take questions from the media. And again, for those who are joining us for the first time on one of these virtual media conferences or media briefings, there is a bit of a delay from our side to what is broadcast online. So if you are a member of the media who's been thinking about asking a question, don't wait till the very end, because there is the risk that the question may not come through. So again, you just need to click on the question mark inside the text bubble here on Microsoft Teams, again, indicating your name as well as your media outlet and who your question is for. All right, let's go to the questions. And we've got our first one from Jane Sims at the London Free Press. And Drs. Mackey, Dr. Locke, Dr. Claussen, this is for all of you. Can you be specific about any outbreaks declared that started at an organized sporting event? Which sports are the most risky?
You know, I'm happy to start there. I'm interested in my colleagues' comments, Dan, as well. You know, this is Canada. The outbreaks that we hear about are primarily those in hockey. There have been a number. I mentioned the hockey outbreak associated with the tournament in Peel recently. There was also an outbreak associated with the hockey tournament in Quebec in August. Last winter, we saw a number of outbreaks in Ontario and elsewhere associated with hockey at all levels. The issue, though, primarily is the sports where you have one-to-one coverage for a prolonged period. Any sport that has person-to-person coverage as part of that sport, where both players will be, you know, breathing deeply because they're working hard, substantially increases the risk. And then, you know, beyond that, it's really about metabolic activity. So the more vigorous the sport, the increase the risk related to that increased respiratory rate.
I'll just add to that, similar to Middlesex-London Health Unit, we had cases in our associated with hockey events, the great Canadian winter activity. Of course, much activity last winter was truncated because of we closed down a lot of this as we got into the wave over Christmas and into the early part of the year. So even with the minimal amount of play that we had last year, we saw spread, and we do hope to have a lot more play this year now that so many of us are vaccinated. So I think this is an added measure to ensure that we can do this safely this winter.
Yeah, and I guess I'll just add, you know, the same, we've observed the same things in here on Perth. I'm also aware of outbreaks that happened in basketball teams. And I'm also concerned that because there weren't that many activities before, and we're having many more opportunities in step 3, that we put in all the protocols that we can to keep everybody safe.
Thank you very much for those answers. Let's go to the next question. It's a follow-up from Jane Sims for Dr. Mackey. Dr. Mackey, at least 3 London minor hockey associations have followed the advice and ordered double vaccinations in August. Are there other local sporting groups that need to make similar requirements for play?
Yes, Jane, all of them. I mean, this is really becoming the standard. I think any sort of facility or league that doesn't use this sort of criteria for keeping their youth and players and families safe is putting themselves at risk, because they're not, you know, meeting what is becoming a basic standard of service.
Let's go to our next question, and it comes to us from Jerry Dewan at CTV London. And this, Jerry hasn't specified who the question is for, so I'll watch for hands on who'd like to take this one first, and if there are further comments as well. Jerry's question is this: are there concerns about verifying, and I think he means verifying vaccination status at all locations?
Well, I'm happy to start that off. I mean, I think there's going to be a learning curve, and that the local health units will be there to assist the facilities in how to verify, and I'm assuming they mean verifying vaccine status, right? So there is the provincial certification system, and that it will be built on that.
Dr. Locke?
Yeah, I'll just add that we do hope that with the assistance of the province and the upcoming app that's promised, that this will not be a big burden for those attending these sports facilities. We also want to reiterate that it's our best method of trying to keep these sports going all winter. If we have one person in a team that gets COVID, it not only impacts that one person and their family, but often the whole team is unable to play in the following 10 days while their colleagues from their team have to wait to see whether they got infected. And so it's a bit of work to do this work about checking for proof of vaccination, but I think it's a small job considering how much pleasure everybody will get if they can continue to keep the team sports active.
Thank you very much, Dr. Locke. Dr. Mackey, do you have any additional comments? All right, let's move to the next question. It's another one from Jane Sims at the London Free Press. Dr. Mackey, this one is for you. Have other Ontario health units made similar recommendations?
Yeah, for sure. Thanks for the question, Jane. So there are a number of other health units that have taken these sorts of measures. York Health Unit, we look closely at their letter of instruction related to this. Recently, Windsor-Essex Health Unit decided to do the same. The 7 northern health units have all issued a letter of instruction that is somewhat similar. There are other health units that have also issued letters of instruction that cover different subgroups of the groups that we are covering in these letter of instruction. So again, this is something that's becoming sort of standard of practice across the province.
Thank you very much, and I'll just make a reminder to the media joining us this afternoon. If you have not yet asked a question and you do have a question to ask, just click on the question mark inside the text bubble here on Microsoft Teams, indicating your name and your media outlet, as well as who your question is for. Let's go to the next question. Dan Brown is joining us from the London Free Press this afternoon. And this one again is open, so I will watch for a hand or if someone wants to jump in and answer this one. Does a letter of instruction come with a penalty for facilities that don't comply? And if there is, what is it? Dr. Mackey.
Sure thing, Dan. And Dan, the letter of instruction actually describes the penalties as well. So, you know, our Provincial Offences Act set fines of $750 for individuals, $1,000 for corporations, and then maximum penalties increase up to $100,000 for individuals and $500,000 for corporations. There is potential for jail time as well. I don't anticipate needing to go into any of those extreme amounts, but they are available under the legislation if needed.
Dr. Claussen.
Yeah, and if I could just add that, you know, the idea is to start with progressive enforcement. So education and just helping facilities come into compliance. We simply want to keep everybody safe and playing and having fun.
Thank you very much. Dr. Locke, did you have a comment to add?
Yeah, and I'll just add that part of the reason that we did this jointly as 3 health units is that a big part of having fun in a lot of this organized sports is the tournaments that cross health unit boundaries and allow our players to interact with other players across the region. And so it's not about penalties, it's about trying to ensure that we have as normal as possible recreational sports season this coming winter.
Thank you very much, Dr. Locke. We do have a follow-up question from Dan Brown. I don't know if we have this number, but I'll ask the question anyway. How many facilities will be affected by the letters of instruction, or for that matter, how many letters of instruction will be sent out?
I can start that one if you'd like. So the types of sports that we are most concerned about, as Dr. Mackey indicated, are those where there's a lot of physical activity. So indoor soccer, hockey, basketball, volleyball, that sort of stuff, martial arts. And that's where, there's a lot of close contact. There's a ball often that's shared, and so just the whole setting is set up for transmission. So we definitely will be sending out letters of instruction to all those facilities that house those type of activities. And along with that, it will go to other places that are private who may also house those, so both municipal and private settings. Most of our health units have a list of these settings because they're often inspected by our health inspectors for other reasons. So we'll work through our contact list and be sure to get the letters out, and we'll be there available to those owners and operators to assist as needed.
All right, anyone else have any comments they'd like to add? All right, let's move on to the next question. Jerry Dewan from CTV London. Dr. Locke, this question is for you. Jerry says, Dr. Locke, on a separate matter, your health unit, along with area physicians, made a specific appeal for people to get vaccines. Why is it important in your jurisdiction?
Well, I think it's important in all jurisdictions. We are doing well here. We're over 80% of our population who are eligible are getting are up to 2 doses, but that still leaves a percentage there. We're heading towards 90%. That's our goal. I know we can do it in our community. We've had a lot of support, and so it's a call out to those who've delayed that decision somewhat or wondered about it for any reason, and to say, look, this is really important. It's the best intervention this season to keep our sports facilities open, to keep our schools open, to keep our businesses open. Vaccines are safe, they're easily available. So let's just reach that last mile and get our percentages up and over 90%.
Thank you very much, Dr. Locke. Let's go back to another question from Dan Brown at the London Free Press. Do you have any idea of how many players, volunteers, coaches, spectators this change will affect? Dr. Mackey.
Yeah, so I appreciate the question, Dan. I mean, the change will certainly apply to thousands, probably tens of thousands of people in London and Middlesex anyways. However, the vast majority of those folks are already vaccinated. In the 12 to 17-year-old group, we're at about 85% first doses, and that is climbing and well over 80% second doses for that population. And then some of the adult age groups is even higher than that. So although the change applies broadly, many people, vast majority, are well prepared for this already.
Thank you, Dr. Mackey. I'm looking, Dr. Claussen.
Yeah, I would say similar in Huron-Perth, and it's going to apply to many organizations and many people. And though many people and many organizations have already taken these steps, and we're pleased about that, and like to see the safety increase across all of these recreational sports.
All right, let's move to the next question from Craig Needles at Blackburn News. This is a question that is open, so again, I'll watch for hands. School sports have been on the go for a while already in some cases. Why put this rule in place now? Why not do it in September when school started?
Yeah, maybe I'll start there, Dan. Certainly the Middlesex-London Health Unit did recommend that schools put this rule in place back in late August. And many schools and school boards in the area have already put this in place, so they're in a good position. What's happened since then is the provincial vaccine passport system was announced, and then it was implemented, and then we got to see exactly what the rules were. So that passport system becomes something we can build on and support. And although the province did leave the 12 to 17-year-old group and some of the spectator coaches out of the regulation, They certainly have encouraged local medical officers of health to include those populations where we deem it appropriate, and the Chief Medical Officer of Health has reiterated that.
Dr. Claussen, Dr. Locke, any additional comment?
Well, I think the other issue is that in September, we waited to see what the vaccine passport statement would include. We did note the gap here. We also fortunately had September where the weather was pleasant. Many of the summer sports were still continuing on outdoors, baseball, soccer, etc. But now as we're heading into the colder, darker days, we know that more of us will be going indoors. So there is an onus to not wait for the province to move locally to protect our citizens. And so we that's why we did this letter now.
Thank you very much, Dr. Locke and Dr. Mackey. Next question is from Jane Sims at the London Free Press, and this is, I think, one of those questions that is probably on the minds of a lot of people right now. What is the difference between the letter of instruction and a Section 22 order? Who would like to tackle that one? Dr. Claussen.
Well, I can start. I mean, this letter of instruction is actually made under the Reopening Ontario Act. And so that act permits local medical officers of health to issue additional instructions based on local conditions that are legally binding. Whereas a Section 22 is an ability under the Health Protection and Promotion Act that always exists for local health medical officers of health to address a communicable disease issue in their health unit.
Thank you, Dr. Claussen. Anyone else have any comment on that one? Okay. Thank you for that response. We do have I think another question here. So if you are a member of the media and you have been waiting, now would be the time to get that question in, as we are getting to the end of the questions we have in queue. Let's go to a question from Andy Bader at the Mitchell Advocate and Post Media. Andy, thanks for joining us this afternoon. Dr. Claussen, I think this was probably for you. Huron-Perth School Board does not have double vaccination policy. Does the Avon-Maitland and Huron-Perth Catholic Board need to mandate this as of October 31st?
So no, because this applies to this applies to recreational facilities such as municipal and private. This does not apply to schools that have separate guidance from the province, and I have not issued instructions to the school boards in this regard. I have made strong recommendations, the same as Dr. Mackey and Dr. Locke, and so the schools have strongly recommended that anyone that is eligible that is participating in these sports be vaccinated. I know that school boards are also looking at other issues that impact them, such as equity issues for their students. But we are, we have regular meetings and communication, and if that step, if the local data were very, very concerning, we may take I may take additional steps, and I know that also. The school boards are always also looking at the recommendations from public health, the guidance, the local context, and also making decisions.
Thank you very much, Dr. Claussen. All right, let's take a last look at the queue, and that takes care of our questions from the media this afternoon. And again, thank you to the media who were able to join us this afternoon, and also again to Dr. Claussen, to Dr. Mackey, and to Dr. Locke for joining us. And thank you for taking the time and for being with us for this announcement this afternoon. We thank you. If you are a member of the media in the Middlesex-London Health Unit region, our next regularly scheduled virtual media briefing will be tomorrow afternoon at 2 o'clock, and we hope to see you then. So thank you, and have a great rest of your Wednesday afternoon. So long for now.